Hi, I'm Patricia Coker and I'm the Head of Service for Integration for Health and Adult Social Care at Central Bedfordshire Council. We're here at the Groveview Hub development, which comprises the Integrated Health and Care Hub, as well as 3 apartment blocks of 98 apartments for people who are aged 55 and over. It's an integrated development and it's a fantastic development for the people of Dunstable and surrounding areas. It brings together primary, community, mental health and social care services to deliver joined up working. It is much more than the building. It's about the transformation of services and how we deliver much more joined up care for population of this area. It really is the achievement of a long-standing ambition of the council to deliver integrated health and care hubs. The whole process started nearly 10 years ago, and this is our flagship building. It's a fantastic location. It repurposes what was a disused football site for Dunstable area into this beautiful, fantastic facility for the people of Dunstable. There's car parking, disabled parking spaces, car charging spaces, and we're also green in the sense that we've got bicycle spaces and as well as the green roof. And this is a building that prides itself in its green credentials generally. So welcome to Groveview Integrated Health and Care Hub, and I'll take you through now. Here we are at the Groveview Hub. This is the reception space. When people come in and they've parked their cars, they get a ticket and they put it in the cars to allow them, it gives them the 2 hours free parking that is needed. Here's the reception team. Hamza is in charge of the reception team and he looks after everybody who comes through. We've got the reception area, we've got some cafe space, and importantly also we've got the hot desk area, which means that anybody at all can come in and use this space. They plug and play, they've got access to the internet in order to do the work that they need. The cafe space is being looked into, and we hope to have a provider in there, so not in the not too distant future. In the meantime, there is of course a vending machine that people can use, and hopefully that will just suffice for now. We've got a nice outdoor area that again is accessible in the summer months and can be used. The Groveview Hub is not just for older people or adults, it's also about children. So we have children's services here. This is the Children's Cambridgeshire Community Services Rapid Response Team are based in here. And again, it's a good space for young people. This is their waiting area, and the teams then work from across the space. Outside, we've got a play area that is laid out and again, perhaps child-friendly, so young people and children will be able to play out there, particularly in the summer months, or just give them a space to exercise themselves and have a run around as necessary. So as well as the children's rapid response teams, of course, we've also got the child and adolescent mental health service teams as well, working together. You've got the dietitian there on duty by the looks of it today, but we've got CAMS, and it's that opportunity to bring the services together to work much more closely together. As part of the design of the building, we did really think very hard about the adjacencies of the services and how they will need to support each other. So you've got speech and language therapy, you've got the dietitian, you've got rapid response, and the child and adolescent mental health teams. So here we are in Path to Recovery, which again is a confidential, discreet service. It's got a separate entrance, so customers and service users are able to use that entrance. The receptionist is able to see them as they come to the door and then lets them in, and they can come into this safe space to get the treatment and care that they need. So here we are in the out of hours area. The service usually starts from about 5 p.m. in the evening. We've got the reception area, and the GPs who work out of here will work out of the sort of consulting rooms. This is one of the consulting rooms there. Now, although the out of hours service works from 5 in the evenings, during the day, this is the multidisciplinary space, so there will be the opportunity to run multidisciplinary clinics where groups, patients or residents can be invited over to have a discussion about how the teams can work together to provide much more joined up integrated care for them. The out of hours service has its own entrance, again because it needs to be accessible at all hours through the night. So customers or patients will come in through the separate door. The receptionist will see who it is and then let them in so that they can receive the service. It's not a walk-in service. Patients get referred in by dialing 111 and then they get referred in here. So the team here are already expecting them when they show up to receive care. So here we are again on the ground floor. We're in the space actually where we've got the key share bookable spaces, meeting rooms, which can be used for meetings or for training. What we've got, one of the rooms we've got here, for instance, is quite extensive, and the Dunstable Town Council, for instance, are now using it much more frequently for their partnership meetings. So it is a space for everybody in the building to be able to use. It is also bookable for the voluntary and community sector organisations to come and use, because one of the things we want to try and do is actually encourage that sort of well-being aspect of the building, the multiple use. So it's not just about medical care, it's also about the public health functions and other things that the building can support. And then further down the corridor, we're coming into IAPT, again, which is the talking therapies, and you will get the chance to speak to Sharon very shortly, who I'm hopeful will talk to you about the opportunities of working in an integrated health and care hub and the relationships that they're now establishing with the other services within the building. Hi Sharon, how are you? Good morning.
Lovely. Hi, I'm Sharon. I'm the operations manager for Bedfordshire Talking Therapies. Yes, we've been here at Grove View since it opened, and we're really excited and absolutely love working here. We work throughout the county in Bedfordshire, and the vision for Talking Therapies was to be situated in all of the hubs and all of the primary care settings throughout Bedfordshire. And I have to say, this is the best one. This is the nicest one. It's clean, it's new, it's state of the art. The parking is fantastic, which is always a bugbear for patients and for staff. So it's just fabulous that we can come to work, we park, we come into a lovely new building. We've got beverage bays where we can make our own tea and coffee and have lunch. And the patients are really enjoying the space as well. They like coming in here. It means that they can see their therapist that's close to home for our Dunstable patients. It's also meant that we can work with other primary care providers. So we're working very closely with Priory Gardens, who are also based in the building. And that's great for Talking Therapies. It means that we can pilot some really new ideas. So we can work with their primary care link workers and really have that very quick response to a patient that could be suffering from stress, depression, anxiety, and they can see a therapist very, very quickly and within the same building. So they can come here to see their GP and then they can come and see us and without too much of a delay, which is very positive. We've been able to pilot some other ideas where we can work with training with the GPs, which is great. So Talking Therapies will be on their agenda and we can use that. So yeah, it's been very exciting and really, really helpful for us. And you know, just in terms of cost as well, so we have to pay for estates throughout the county, and this is one of the cheapest estates that we've got on our books, which is fantastic. It's a premium. Trying to find good clinic space for patients is really difficult, so this has been very positive for us.
where I'm sat here in the one of the waiting spaces for the Priory Garden Surgery, which is the main practice that is moved into the hub. It is the biggest practice in Dunstable, and it's a growing practice. It provides a real opportunity to interact with the community health teams in a much more dynamic way, community health, social care, and actually also supporting the approach that we're building around multidisciplinary clinics, perhaps around frailty, or for supporting people with long-term conditions. So all of those initiatives, which is all about how we transform the delivery of care and bringing new ways of working, is really beginning to happen as a result of the work with the Chiltern Hills Primary Care Network and also the teams who are located in this building. New things are happening, there are new innovations coming through, and we'll get the chance to speak to Nazir very shortly, who will be able to tell you much more about what's been going on here.
Hi, I'm Dr. Nasser Hanan. I'm a GP based at Priory Garden Surgery. I'm also a research lead at the East of England, and I'm also on the executive committee for the LMC. It has been phenomenal moving into Groveview in that we've got more space. There were many things that we wanted to do whilst we were over at the old surgery at the health centre, but we were constrained. Immediately since moving into the hub, we've now become a training practice, and we've actually got some of our trainees who have now joined us. We're looking to expand into nurse training, but we have the space and the confidence to then deliver a very good training experience. In terms of research, we're looking at potentially using the hub to support for the vaccine trials that are now going to be coming out against cancer, which will give us a great there'll be an advancement of science that occurs as a result of being in the hub, but we'll have the space to continue that work. It's been an amazing 6 months, but we look to see what happens in the future.
So how are you finding the adjacencies with other services in terms of the multidisciplinary working?
So before we'd have to send tasks, or we'd have to arrange telephone calls. Now we can literally just walk upstairs and talk to somebody from a different service if there's an issue. A really powerful thing with the hub has been when you randomly see somebody in a corridor from a different service, you find out about their service, they find out about ours, and this is leading to a strengthening of the relationship, and it will be interesting to see what develops as a result of that.
So thank you very much for talking to us and taking time out of your busy day, and we're going to carry on and move around discreetly and not disturb your patients, so thank you very much. So here we are in what is essentially the multidisciplinary hub of the Groveview hub. We've got social care teams, so adults social care teams. We've got mental health teams from community health services who sort of work on this floor, as well as some of the primary care network teams as well. And it is that opportunity to promote the sort of multidisciplinary approach that we're talking about, which is really what underscores the vision for the integrated health and care hubs. It's the opportunity for speaking about patients or residents, opportunistic interaction to talk about, oh, I've seen Mrs. Jones, are you going out to see Mrs. Jones? Could you do such and such? She might need some medication, or she might need a district nurse coming in, or could we get some further advice? And it really is just pulling together the teams to work in that sort of much more cohesive, joined up way. So this is the multidisciplinary space, which includes the adult social care teams, and we're just going to go and speak to Raquel, who'll tell you more about the service. So hi Raquel, good to see you. How are you?
I'm good, thank you.
Good. So it'll be good to know what you feel and how you see working at the Groveview Integrated Health and Care Hub, and what it's been like for yourselves and your colleagues.
Okay, so my name's Raquel Vaughan, and I'm the operational manager for Community Assessment Service, which essentially is adult social care for Central Bedfordshire Council. The team have been in situ in the hub now since April. The opportunities that it provides is that it allows us to be closer aligned to other organisations and disciplines. So, for example, the community health services are based here, along with mental health services, and it means that for us, working with individuals and people that are located in this locality, it means that we can meet with colleagues in a multidisciplinary way to work through what's best for individuals and ensuring that we can achieve the best outcomes for those individuals.
That's lovely, Raquel. Thank you very much. We'll have a look around and try not to disturb colleagues because I know everybody's very busy, but thank you. So here we are, we're here at the third floor of the Grove View Hub. It is a space that is used predominantly by staff. It is their own safe space. As you know, people work very hard and we want an area where they can come and relax during the course of the day. There are changing spaces in terms of changing rooms. If they cycle into work, there's places where they can have a shower and get changed for the day. We've got it for the men and we've got it for women as well. There is some kitchen space where they can prepare their meals through the course of the day. And importantly also, we have hot desk area up here, so again staff can come and have a quiet space to do some work. One of the issues when we were doing the planning for the hub was the final design was happening at a time of COVID. And we appreciated the pressure that staff were under and the need for them to have a space where they can come and decompress and just, in essence, breathe, because that actually is one of the themes that has come through in terms of the artwork that we've got in this space. So this is the staff rest area. It's a good space, it's very light. It gives them a good view of the downs as well, so when you can see that, and it is often very well used. It doesn't appear like that at the moment, but then that's because we're filming first thing in the morning and my colleagues are probably hard at work. But there's a nice kitchen space for them to prepare their meals, and again, I suspect this place gets quite busy of an afternoon. So here we are again in another part of the third floor where we've got the East London Foundation Trust Mental Health Services team in their sort of consult and treatment rooms. All the rooms are in use and they are nicely again located next to the children's locality team, which as you see we're going to speak to. This is the Central Bedfordshire Children's Locality team. Colleagues are very much ensconced in the space, and it's a nice space for them to work in. We will try not to disturb them for too much. You'll be familiar with the pods that we put in that are already in there for sort of safe working in the environment that we have, and that is it. So here we are again, another part of the third floor building where we've got the MSK clinic, which is the musculoskeletal clinic. It's got its own reception, potentially a shared reception for other services, but they are all fully occupied here. We've got the wait area as well, which again is fairly discreet, and people can come in and wait to be treated. This is the Grove View. This is the dental hub or the dental surgery. So what will be the Grove View dental service? It's currently empty because we're trying to procure an NHS dentist as opposed to just any dental service within the building. So the ICB is working to do that. We anticipate dental surgery to be in here by next year, But in the meantime, it's important to say that we're not leaving this space unoccupied. The hospital is working to bring some of his out of hospital services in here, so that will operate from here in the very near future. We have the rooms. We've got 2 dental spaces, 2 dental rooms where treatment can be given, and actually it's all piped and ready to go. The piping on the floor will be capped up, so that the hospital teams will be able to use that space safely without disturbing what is already in there. And the other thing is that we've got the X-ray room as well, so that X-rays can happen. It removes the need to send people into the hospital, but it is the X-ray room for the dental surgery. It's important to note that, not a general X-ray room. But it's a great space, and some of the teams that have visited this space are really excited to come and work from the area as well. So here we are at iCash, which is a very discreet service. It's the integrated contraception and sexual health service for, again, population of Central Bedfordshire. But it's an area where we really, it's limited access. And the very important thing is that people can come into the building. Nobody needs to know where anybody's going. They just come in, get in the lift, come up to the 3rd floor and come into this very safe space to receive the service that they need. So that's it, colleagues. I hope you've enjoyed the tour of the Groveview Integrated Health and Care Hubs. You've enjoyed the conversations with some of the teams who are working in here. Thank you for coming through. It's a fantastic opportunity and a fantastic facility. If you'd like to find out more about the services here, you can log on to the website. Details will be at the end of the video. And if you want to come and talk to me about it, I'm open to that as well, and look forward to seeing you all very soon. Thank you.